Okay, welcome everyone, and thank you so much for joining us for today's lunch and learn in honor of National Latinx HIV/AIDS Awareness Day. I know it is also Spirit Day, so I'm rocking the purple, and I know so many of you are as well. It's purple; it's not blue. Um, and I know that you join me in being really excited about today's panel. HIV is not a crime. Uh, I'm Jennifer Lynch, and I work in corporate social responsibility along with my partners in crime, Erin Jordan and Stephanie Aguilar, who I know you all know and love. Um, and we want to first give a shout out to our good friends at the Artemis Agency for bringing this together. Sarah Adelson always provides such amazing programming and partnership, and so we are grateful to once again be working with you. Uh, I'm sure, like me, when you first learned that there were laws criminalizing people with HIV, it's just shocking. Um, Paramount, through our Paramount Fights HIV/AIDS initiative, has been working in this space for such a long time. And so many of the people in this webinar are part of the education, the activism, the engagement, the volunteerism. We've been known to raise a little bit of money as well for our favorite AIDS organizations. And so to think that we've all been working in this area for so long, and this was the first time to have heard about the issue, it's really quite surprising that despite scientific advancement, that we still have more than 30 states that have outdated laws on their books that persecute people living with HIV. And it is shameful. But it's also complicated. And it's an issue that disproportionately affects our Latinx population, which is why we wanted to have this discussion today on National Latinx HIV/AIDS Awareness Day. And thanks and a huge shout out to all of our members of SOMOS who are here, our employee resource group. But it affects other marginalized communities as well. So I'm glad that Emerge is here. I'm glad that BEAT is here. I know we have a lot of employee resource groups here. So thank you all for joining. And to help us understand a little bit more, we've got the team from the Elizabeth Taylor AIDS Foundation, and they've organized an incredible panel. Folks might recall the last time that we worked with the Elizabeth Taylor AIDS Foundation, we had a special screening at the Paramount Theater of A Place in the Sun, the one movie that Paramount was lucky enough to do with Dame Taylor. And we had some representatives from the Elizabeth Taylor AIDS Foundation come to that screening and talk a little bit about their work. And I am just so grateful for the opportunity to part with them again. So let me tell you who we've got here with us today. First off is Diana Oliva. She's a senior manager of community engagement at the biopharmaceutical giant Gilead Sciences, and I'm sure we've all heard of Gilead. Diana has worked in the field of social service and public health for more than 25 years, so she knows what she's talking about. She is the first openly transgender person hired by Gilead, and is currently developing the first ever global transgender community engagement strategy by any biopharmaceutical company in history. And we wish you great luck with that. Next up, we have Tammy Martin. Tammy Martin is the legislative manager at Equality California, and everybody knows Paramount is a huge supporter of Equality California. So Tammy, thank you for being here. In that role, Tammy advocates for the organization's legislative and policy priorities in Sacramento. Prior to joining Equality California, Tammy served as co-president of the LGBT Bar Association of DC. She worked with the LGBT Research and Communications Project at the Center for American Progress. And Tammy and her team are leading the policy work in the HIV is Not a Crime campaign. Thank you so much, Tammy. Next up, we have Marco Castro Bojorquez. Forgive the poor pronunciation from the Irish Catholic over here. Marco is an HIV human rights advocate and an impact filmmaker. I watched one of his movies last night. We're going to talk more about that later. Marco was a lead organizer with the Coalition of Californians for HIV Criminalization Reform in 2017. He is currently the co-chair of the HIV Racial Justice Now. It's a coalition of HIV leaders of color that have written a racial justice framework to end HIV, and it's entitled A Declaration of Liberation, Building a Racially Just and Strategic HIV Movement. He is also a steering committee member of the U.S. People Living with HIV Caucus, and one of the organizations that formed the Health Not Prisons Collective, and what incredibly important work that is. Marco, thank you. But he's also an artist, and Marco creates films that highlight the experiences of the LGBTQ Americans and has been recognized by President Obama and his White House for his important work. Thank you so much, Marco. And last but not least, we have Queen Victoria Ortega. Queen Victoria is an advisory board member for the Elizabeth Taylor AIDS Foundation and serves as the national president of Flux, a network of trans leaders dedicated to raising the profile of trans and gender nonconforming communities. She has also served as a member of the Los Angeles County Prevention Planning Council, the LA County Commission on HIV Health Services, the Transgendered Service Provider Network, and the California Endowment's Building Healthy Communities in Boyle Heights. We have amazing respect for the California Endowment, the work they do. We partner with them often, and we are so grateful that you are joining us from London, where it is a little chillier than it is here in Los Angeles. So thank you all so much for being here with us today. A huge word of gratitude to the Elizabeth Taylor AIDS Foundation for making this possible. Ms. Taylor was a beloved member of the Paramount family, and her AIDS activism continues to inspire our work in the HIV and AIDS sector. I think there is no more visionary leader when you think about the celebrity world than what Elizabeth Taylor did in this community, and did it at a time when it was not easy to do, when it was not acceptable to do, and she broke those barriers in her activism as she did in her career. So we are just so grateful to partner with you folks. Diana, I'd like to start with you. So in your role in Gilead, you're working with a number of different organizations like the Elizabeth Taylor AIDS Foundation and a number of grassroots organizations to modernize HIV criminal laws. Can you help us define what modernize means in this context? I'd love to know why the issue, obviously we all know the issue is important. I'd love to hear you tell us why the issue is important, but when you think about how long HIV has been around, it's amazing to think we're using the terms modernize in that context. So I'm hoping that you can contextualize it for us.
Yes, of course. Hi, everyone. I'm Diana Oliva, Senior Manager with Community Engagement in Gilead Sciences. Thank you very much. First of all, I would like to thank Paramount for hosting today's conversation and my fellow panelists whose work I follow and admire. So it's so good to see you, Queen Victoria and Marco. Saludos, felicidades. Each of us here is because we are devoted to ending the HIV epidemic. While we have made tremendous progress over the decades, there's still so much work to do in the United States and around the world, unfortunately. But one reality that we must confront is the social and discrimination that goes beyond the social and cultural norms. There are actually HIV laws that are written into the books, unfortunately. Today, in 2020, 32 states have laws that most, unfortunately, were created over 40 years ago that criminalizes a person for having HIV. These laws aren't based on today's science, unfortunately. They were created at the height of the epidemic in order to stop the spread of HIV. But in today's reality, they do nothing to protect people. In fact, they do the opposite. They make it harder to achieve the mission everyone is here today, and that is to the end the HIV epidemic. The issue is also important because communities of color are disproportionately impacted by HIV. Since today we are celebrating the National HIV Latinx Awareness Day, for instance, in 2018, Latinx people were 4 times more likely to be diagnosed with HIV than white people. By extension, that means Latinx people are more vulnerable to being harmed by HIV criminalization. These kind of laws perpetrate a vicious cycle. They are, of course, a gross injustice for those directly affected by them, and for the wider community that has to live in fear of persecution and are further stigmatized and marginalized. So hopefully that gave you a quick overview of why it's important to modernize these HIV criminalization laws, unfortunately.
Well, I think it certainly provides a lot of context for why we're talking about it today, right? Knowing that the Latinx community is 4 times as likely to be diagnosed with HIV than Caucasian folks. And that really disproportionately affects who's going to be affected by these laws. Can you tell us a little bit about your company and about what your company is doing to help address the issue?
Yes, definitely. Gilead brought some community partners and some national alliance partners to our corporate headquarters office in Foster City, California, earlier this year, actually the last week of January. And unfortunately, I was not a part of that conversation, the original conversation. But once I found out that we were engaging in this initiative moving forward, I needed to even just, if I can at least be a fly on the wall, and flies are very popular nowadays, as you can imagine. Since they knew that I was interested, that I was deeply passionate about HIV decriminalization work, that they've actually asked me to lead this initiative on behalf of Gilead. And so I'm very proud to work at Gilead and making sure that not only are we addressing HIV, but I think at Gilead, we feel that it's going to take more than medicine to end the HIV epidemic. And this is one of the reasons, or one of the initiatives that we are proud to engage with. So the 5 community partners that make up the Health Not Prisons Collective is the Transgender Law Center, the US People Living with HIV Caucus, and the Zero Project, the Counter Narrative Project, and there's one more that I always keep forgetting. I forget, but anyways, the collective.
The Transgender Law Center is the other one.
No, I said the Transgender Law Center, Zero Project, HIV Caucus, oh, Positive Women's Network. How can I forget? So in 2020, the collective aims to fill a specific need within the larger conversation in both the HIV and the abolition movement. The collective focuses on narrative change designed to shift discourses about HIV, the HIV risk, blame, responsibility, and the role of the carceral state, including detention, centering racial and gender justice. I do believe that by working together with the collective and our partners such like the Elizabeth Taylor AIDS Foundation, there will come a time, and I hope very soon, when no state in America will have discriminatory laws on the books, and that we'll be much closer to ending the HIV epidemic. So I'm very proud to work with the Health Not Prisons Collective, and I can't wait to making sure that we move the needle forward in the years to come.
I think, obviously Paramount works in the community a great deal, and we love to hear that word collective or coalition. I think there's so much more that can be achieved when it is nonprofit organizations working together towards a common goal. So I love the fact that you've pulled this collective together, and I think it's so important.
I believe, this is the community issue and an epidemic, and I really believe that infusing our community partners to design the community solutions is the best approach.
It's so true.
And the sponsor of Gilead, we love partnerships with our community partners. So this is a great example of how pharmaceutical giants can come together with community partners.
It's that public-private partnership, right? That is always
Correct.
So much more effective than just going it alone. That's
yes,
great.
We need everybody at the table to come up with solutions. So definitely.
So we've talked a little bit about Gilead, but Diane, I'd love to learn more about, knowing this is so personal for you, a little bit more about your story, if you could share with us.
Yes, most definitely. I grew up in a very small rural town outside of Fresno, California. And as you can imagine, as a trans woman growing up, the word transgender was not even in our vocabulary in the 70s. And so for a shy, feminine, awkward little kid in a small rural town, you can imagine the harassment and the constant bullying. And so unfortunately, I lived with a lot of stigma, shame, and guilt and fear for being who I was. And in 2000, 20 years ago, I was diagnosed with HIV. And I remember my world coming to an end, or so I thought, and I knew I couldn't deal with my HIV status and my gender identity and a small rural town outside of Fresno. So I made the move to relocate to Los Angeles. So there I could meet other folks who were, in a similar situation. And so, but unfortunately, still struggling with my HIV identity and my gender identity, I ended up on the streets in Los Angeles on Santa Monica Boulevard in Hollywood, to be exact, and did street-based sex work in order to survive. As you can imagine, transitioning from male to female is a costly endeavor. And at that time, there wasn't a lot of health benefits or any type of benefits for individuals like myself. And so many of us, especially Latinas, trying to survive, we worked in street economies as sex workers in order to put a roof over our head, clothes on our backs, and food on the table. And so, and to incur of all the legal and medical transition related costs. And so during those experiences on the streets of Los Angeles, I was arrested numerous times. And I did not know at that time that being HIV positive and being engaged in street-based sex work would pose even a greater jeopardy for my criminalization interaction. And so I was charged with the misdemeanor, of course. And then once they knew that I was HIV positive, they were trying to enhance the charges to a felony. And so unfortunately, I had a great lawyer, and they dropped it down to a misdemeanor, but I ended up still serving 6 weeks at the LA County and Twin Towers jail for men. And after that experience, I really became an advocate for HIV causes, and one of them being the decriminalizing our HIV laws that are so archaic and were created in a time where we did not have innovative science. And today, now in 2020, almost 40 years ago, now we can really base our laws based on today's science. And so I get to share my story with you all, but my story and my life has always been about giving voice and visibility to not only the HIV community, but to the multiple overlapping identities that my life has touched.
Diana, that's really an incredible story. And I want to thank you for sharing it with us, for being so open and honest. And it's pretty inspiring to think what you've gone through, how you've come out the other end, and how you're giving back now to the community. Thank you so much. Thanks for sharing that with us.
No, thank you so
we're going to bring Tammy into the conversation now. And Tammy, first of all, like I say, Paramount has been a supporter of Equality California. We feel so strongly in the work that you're doing. So thank you for your leadership there. Recognizing that this is a very complex issue, and I'm sure that there are still a lot of folks out there that think these laws are protecting the public. I know you've got a presentation. Erin's just brought it up here. Can you help us better understand through this presentation really the reality of the situation?
Definitely. Thanks, Jennifer, for the introduction. So I'll be providing some foundational principles to guide the rest of today's discussion. So a quick note on terminology, some of the words and acronyms you might see or hear today. The acronym PLHIV means people living with HIV, and it will pop up in my presentation just to save space and not overload you with too many words on each slide. But I do want to note that the structure of the phrase people living with HIV centers the person and emphasizes that HIV does not define that person. So people or a person living with HIV is preferable for some people to saying, for example, an HIV positive person or similar. Next, U equals U means undetectable equals untransmittable, which reflects the fact that HIV treatment has advanced to the point where viral load can fall to an undetectable level, at which point it's essentially impossible to transmit the virus. We're going to talk, of course, about HIV criminal laws, which refer to laws that criminalize or unfairly penalize people who are living with HIV, and we'll talk more about this in a moment. And then finally, the effort to fix the problems inherent in HIV criminal laws is referred to as different things. Today, we'll call it modernization as opposed to repeal or decriminalization, reflecting the focus on aligning law to modern science. Science, not stigma, as they say, but all of these generally refer to the same effort towards a common goal. Okay, so Equality California was a sponsor of SB 239, which was authored by Senator Wiener in 2017. And this eliminated extra punishments that applied to people living with HIV, even when they were engaging in consensual acts, so that HIV is now treated the same as other serious communicable diseases. So this is just kind of a summary of what the update to the law did. It now includes consideration of practical means that are taken to reduce the risk of transmission. So previously the law didn't account for things like whether the defendant used condoms or was on treatment. It eliminated the felony charge for donating blood, tissue, and or semen for people living with HIV, which is unnecessary because there are already safety and screening measures in place for donations. It also eliminated the felony solicitation charge. And for a misdemeanor charge, the prosecutor must show knowledge of status, a specific intent to actually transmit, an activity that actually carried substantial risk of transmission, and then actual transmission. So this more closely reflects what we know about HIV now. So what does it mean that HIV is criminalized? So this is Michael Johnson. He was profiled recently in the New York Times, just one of many examples, but he's a Black gay former college wrestler who is living with HIV. He's from a conservative town in Missouri, which is one of those over 30 states that Jennifer mentioned that still criminalize HIV. And in Missouri, it doesn't matter if you use a condom, that's not a defense. It's a felony for people living with HIV not to disclose their known status. The only defense is disclosure in advance, which, as you can imagine, can be incredibly difficult, if not impossible, to prove in a court. And that was Michael's challenge. He still maintains that he informed all of his partners of his status, and yet he was originally sentenced to 30 years in prison and became a highly publicized target of HIV criminalization, which could be summed up as the use of laws to specifically target people living with HIV with criminal penalties, and thereby stigmatizing and unfairly penalizing them. And this can manifest in different ways, depending on which state you're in. It can mean prosecution under HIV-specific criminal laws. It can mean increased penalties for underlying sex crimes. And it can mean general felony laws that have been used to prosecute people living with HIV, for example, assault or attempted homicide laws that don't mention HIV, but can still be used against people living with HIV. So in general, it means that someone's positive HIV status is relied on to criminalize otherwise legal conduct, such as donating blood and tissue, which we talked about, to impose sentence enhancements, so upgrading a misdemeanor to a felony simply because the defendant has HIV, and to mandate sex offender registration. So sometimes those enhancements include that the defendant is required to register as a sex offender simply because they are living with HIV. And another time this comes up is what's known as walking while trans, which is when transgender women are profiled as sex workers simply when they're walking down the street. So people interact with these laws in multiple ways. So there clearly are a lot of problems with HIV criminal laws and prosecutorial process. So for example, these laws generally don't consider the possibility that the complainant, which means the person bringing the case, may already have had HIV before the encounter, which you would think is common sense to check, but the laws generally don't account for that. A complainant also generally does not need to prove that HIV was actually transmitted or that the defendant was the source of that transmission. So in fact, the defendant could have been infected by the complainant, and the laws don't always account for that. There are also flaws in the evidentiary technology, so that includes little understood types of genetic testing that are flawed in the system. And the impact of sexual assault. So the laws don't always account for situations in which the person living with HIV does not disclose status because the encounter was a sexual assault. And then finally, the laws don't always account for science. So the criminal laws reflect outdated medical and scientific understanding of HIV, They don't always reflect what we know now about HIV, meaning, what the virus is, how it's transmitted, how it's treated and prevented, etc. So our goal is to help update all of that. But who does HIV criminalization impact? And I believe Marco may be going into more depth about this shortly, but HIV criminalization affects all communities. So we can't really just sit at home and think, well, this isn't something that I need to be thinking anything about, because the reality is this affects everyone. It's a broad public health issue. It affects women. So before SB 239 in California, over 40% of people criminalized under HIV-specific laws were women, even though only 13% of people living with HIV in California were women. People of color, so if you are Black or Latinx, you're more likely to be criminalized under HIV-specific laws. Transgender women, which I mentioned, they are disproportionately affected by HIV, and they're often profiled just walking down the street. This can impact survivors of sexual assault, as well as under-resourced communities. So someone who is more likely to be prosecuted is potentially also someone who is less likely to have access to treatment, whether that's due to cost, stigma, barriers to care, etc. So you might be wondering, well, why has HIV been criminalized in this way? So this is a quote from the New York Times article about Michael Johnson. And as the quote suggests, HIV has been criminalized because of fear and because of stigma and ignorance. And there was a panic during the AIDS crisis that led to HIV and AIDS being treated differently under the law than other transmittable diseases. And there for a long time was a real lack of knowledge regarding prevention and transmission and treatment. And so these laws originated from decades ago in the 80s, when very little was known about HIV and AIDS, and they just haven't been updated to reflect modern science. And when these laws originated, HIV was seen as a death sentence, but thanks to modern science, we know that as long as someone is receiving access to care, that's not the case. Okay, where is HIV criminalized? So as of July 28, 2020, and this shifts kind of month to month, but over 30 states have HIV-specific criminal laws and/or sentence enhancements applicable to people living with HIV. So Nevada, for example, has HIV-specific criminal laws. Ohio does as well, and Ohio has also prosecuted people living with HIV under non-HIV-specific general criminal laws, and may also require that sex offender registration that I mentioned. And I bring up Ohio and Nevada because we are working with the Elizabeth Taylor AIDS Foundation and all of the organizations on the ground in these states to modernize their HIV laws. All right, so what does HIV modernization mean? What does that entail? Well, of course, modernizing. The laws have to catch up to science, and so that we can treat HIV the same as other serious communicable diseases and eliminate those unfair enhancements. This promotes public health. So this reduces stigma, acknowledges a shared responsibility for health, and eliminates barriers to testing and care. And it also means maintaining accountability for people who do intentionally harm others. And why are we talking about this? Why is this so critical? Well, the goal is to get to zero, which means zero HIV transmissions, zero AIDS-related deaths, and zero stigma against people living with HIV. And I'll just quickly go through a couple catalysts for this movement across the country. One was when President Obama released the first ever national HIV/AIDS strategy in 2010, and that recognized that modernization is critical for public health. In addition, the American Medical Association recognized the same and noted that non-disclosure of other infectious diseases is not criminalized because doing so does not promote public health. And finally, modernization is critical for a number of different reasons, right? There's the legal perspective. So achieving equality under the law, that on its own has importance. And it's critical from a data perspective as well. So fewer people getting tested means we don't have accurate data. And it's critical from a public health perspective. So as I mentioned, undetectable equals untransmittable, and our laws should reflect that. Criminalization also impacts our ability to reduce new HIV transmissions and infections because criminalization affects the doctor-patient relationship. It discourages people from getting tested, and it reduces the chances that people will access effective treatment. So on the bright side, where have the laws already been modernized? We already talked about California. And here's that same map, but with a focus now on the 7 additional states that have made significant changes to their laws. And as I mentioned, there are efforts underway in a number of other states that are ongoing. And so what are a few talking points that you can take from this to have in your own conversations if you want to educate your friends or family about this challenge? And so I'm just going to read off the slide here, which is not my preference, but I think it's important to kind of go through these word by word with each other. So many Americans have misperceptions about transmission or are completely unaware of HIV criminalization. So it's not always that someone will be hostile to the idea, but a lot of people just don't know. And so we start with that assumption. Over 30 states across the country, hopefully that number will come down in the near future, but right now over 30 states across the country still have laws that criminalize and discriminate against people living with HIV simply based on their status. And as I've discussed, these HIV-specific criminal laws, they don't protect people from acquiring HIV. They actually make it harder to prevent transmission and to end the epidemic. These laws are inconsistent with science. Modern medications, as we know, can eliminate the risk of transmission, meaning that these laws criminalize behavior with no risk of transmission. These laws also discourage testing, treatment, and disclosure, because it can make people be afraid to know their status because they can be criminalized because of that. Which this bullet also reflects the stigma and the marginalization for people living with HIV. So it's important to emphasize to people that these laws that we're trying to update are really, they're not only outdated, but they're ineffective. They don't achieve what some people think that they achieve. And of course, they are discriminatory. They're used to target people of color, women, as well as transgender people who are living with HIV. And we've learned a lot about HIV since these laws were enacted. We've learned how to treat it. We've learned how to prevent it. These laws were passed decades ago when our understanding was very different. So it's really time to modernize our HIV laws and really bring them in line with current science. And finally, doctors and public health professionals support modernizing these laws because doing so will help end the epidemic. So I mentioned the American Medical Association and the Obama administration. There have been a number of other public health professionals that support modernization. This isn't, you know, a one-off idea that somebody had. This is something that well-respected major medical bodies and professionals support. And that goes a long way with people as well. So hopefully that is helpful in equipping you with some of the basic concepts for the conversation today, as well as some talking points to take with you. So thank you.
Tammy, thank you so much. That was such a comprehensive view of the issue and such amazing information there. I don't know about anybody else, but I pulled from that what seems to be an ongoing conversation right now, that we have public policy that is just not catching up to the science. Obviously in HIV and in so many other areas that that is part of the public discourse right now. So thank you for helping us understand. Marco, this is an issue that you've been working for a long time. And I know that you were very effective in changing the laws here in California that Tammy just talked about. So can you tell us a little bit about how you were successful? What were the strategies that you used here in California to change those laws? And then recognizing that today is National Latinx HIV/AIDS Awareness Day, can you give us a sense of how this affects the Latinx community specifically?
Yes, thank you. I wanted to first acknowledge American Indians. I wanted to acknowledge that I am right now in a territory that used to belong to the Washoe people in Nevada, and we have actually taken this land. So I wanted to acknowledge that and uplift the humanity of American Indians in this country. And then I also wanted to thank everybody that, I'm not going to say any particular organization because I don't want to take a lot of time, but everybody that has something to do for this event to be a reality I wanted to thank you from the bottom of my heart, because we don't talk a lot about HIV criminalization in regards to Latinx people. And so I became working, the first HIV is Not a Crime gathering that is organized by the Zero Project and Positive Women's Network. I was working at Lambda Legal at the time, and they invited me to go to this place in Iowa for this anti-HIV is Not a Crime #1, the conference. And in a matter of a weekend, 4 days, I learned about all of this. And like you, Jennifer, I was in shock that that this existed. And so I came back with the conviction that I was going to do something in California. And I came back to Lambda Legal. And in a month or so, I invited all of these people to a meeting in the offices at Lambda Legal here in Los Angeles. And that's how we started the actual struggle of fighting for HIV decriminalization in California. Later on, the coalition grew, and we had meetings in Los Angeles and also in San Francisco. And then we did a tour all over California, educating people about it. Because one of the things that is important to realize here is that when people tend to instinctively be for criminalization of people living with HIV. But when they learn the realities, what happens to people that there is a disruption in the life of anyone who is criminalized because of their health status. That's ridiculous. The people that are sick, they don't need jail. They need a doctor, they need healthcare. So it was quite a journey working in California, because there is a misconception out there that people living with HIV are going around on a daily basis infecting other people, or transmitting, I should say, because we don't use infected anymore, transmitting the virus to other people. And I'm here to tell you as a person living with HIV that is a complete lie. The people that intentionally transmit anything to other folks are very, very small percentage. And these laws, what it is basically a continuation of slavery, because the people that are affected by HIV criminalization are mostly people of color. And they're also the people that are the most affected by HIV as well, because the pandemic, HIV has become a lot more Black, a lot more brown. And as that happens, the support for HIV, the funding for HIV, the empathy for people with HIV, it also diminished. And so I'm gonna read to you very quickly a quote that I created one day that I was actually reflecting about our work in California. And I wrote, organizing around HIV criminalization is a labor we basically learn as we do. We are writing our history, and it has been certainly not a smooth ride. At the end, I think it should be a rule or a compromise that no matter what, we need to return to be united, to understand one another, because we are all what we have. The world has become more hostile with us since U equals U, or the antiretroviral treatment. And they want us under a microscope. They want us to monitor us, to count us, to control us, because we aren't dying as they thought so back in the days of compassion for people living with HIV. And I say this, Jennifer, because in order to be effective at actually fighting the criminalization of people living with HIV, science is not all what is not enough. We also need to be able to include a framework of intersectionality in our struggles, because people that are dealing with racism, they may be also dealing with HIV criminalization, and that becomes a lot more difficult and complex. We also need to look at some principles that the HIV community has created, which is the meaningful involvement of people living with HIV, or MIPA, which is centered in the work that we do at the collective, at the Health Not Prisons Collective. We also need to look at other aspects like racial justice, and you mentioned the Declaration of Liberation, if we don't include a framework of racial justice, we will never end HIV, period. Because of the people that are most affected are people of color. And lastly, we also need to take a look to the communities. I was so touched by Diana's history or story. We need to make sure that our struggle is trans inclusive, and it's also sex workers inclusive, and people that use drugs inclusive, because those are the folks that are the most affected when it comes to when we look at the data that we have there. And I think that lastly, I will say that the reason, because I feel that HIV criminalization is racism, is because we are seeing it as well with COVID-19. The people that are more affected by COVID-19 are like completely out of control folks in our communities that are also the target of cruelty, like plain cruelty by the government, by the public, by everybody. So it's very important that everybody in this audience take responsibility and do something so we can actually support people, because there is no good laws that criminalizes people because of their health. There is no, and for me, modernization and all of those terms are, in my opinion, just a process, because what I want for these laws to be abolished completely, out of the books, not here, because there is enough of things that we, people living with HIV, have to deal with, to on top of that, have to be worried about being put in jail, when sometimes for us, disclosure is not safe. It's simply not safe.
You know, Marco, I'll say one thing. You had talked about how everybody here in this conversation today needs to take action, and you'll be happy to know that this is a very engaged group. And Paramount is really known for its civic engagement and activism. And we have another Marco who is participating today, Marco Lopez, who's the head of our Latinx employee resource group. And he reiterated a point that you made, which is that these laws, these penalties, are just another form of oppression for communities that do not need any additional forms of oppression. I want to talk a little bit about your film because I so enjoyed it last night, and anyone who's interested, it's 52 minutes, very well spent, and we can share the link for the film later on. If you're interested, let me know. But you know, I always say Paramount we are a group of storytellers. We're an entertainment company. We tell stories, and we recognize the power of that storytelling. I really enjoyed your film, El Canto del Calibre. It had one of the things I know, it's in Spanish, it's subtitled. One of the things I noticed, there are two instances where English is spoken instead of Spanish. One was when someone is using the derogatory terms to refer to members of the LGBT community. And then the second time that English was used was when the father was learning to accept and embrace his daughter and her lesbianism. And for some reason that struck me as incredibly powerful. But your film explores the relationship of Latino immigrant fathers and their children and family members who are LGBTQ, and it does it so well and poignantly. So what do you see as the role of storytelling, and how can entertainment play a part in the modernization of these laws? You know, is this an issue that should be brought to mainstream audiences in a way that may be closer to, we call it edutainment, right? It's education and it's entertainment. So I'd be curious for your perspective on that.
Yeah, well, Jennifer, thank you so much for your thoughts. For me, anybody who watches my film, I have to say that I will be grateful forever. So thank you for watching my film, our film, because it's yours as well. And it is in Amazon, so I'll share with you the information. I want to first, to answer your question, which is really, really important, I wanted to give some freedom to Latinx people in the world. Diego Rivera, this muralist, partner with Frida Kahlo, he said that every single Latinx children is born an artist. So for all of you who are hesitating at expressing yourself artistically, you should know that Diego Rivera said that. So you are an artist. And I think that storytelling for me is just, it comes from my family, because my grandmother, Mama Carmen, she used to, when I was a little kid, she used to sit me next to her, where she used to cook. And and uh, and she would just start telling me stories that I thought that it was much better than any TV show. And so I grew up like telling. I would basically tell stories for everything. And so for me, working at the El Canto del Colibrí or the Hummingbird Song, my film was a gift of life or from life. The people that I interview basically opened their hearts. They used to put put like balloons and flowers when we were coming to film them. That's how much that was the love that and everybody actually became close friends. They are all also waiting for us to work on a second part next year, hopefully, and. And storytelling is actually pivotal to actually our existence, because Latinx people, we have an amazing culture. We have great music, great food. We're also good at dancing, at spoken word, singing, and the issues that are out there in the mainstream that really affect us. We also fight it with art, and after the World War II in the 1920s, after the war, people like erupted with art. That's when amazing things happened in Paris and in Mexico as well. Frida Kahlo and all of them. So I think that when there is oppression in these past 4 years, we have gone through like a major um, era of oppression and targeting violence against our communities. I have faith that if this November we actually fire people that are in the White House and hire other folks, that there's going to be an eruption of this manifestation of freedom, liberation, because our pueblos have gone through so much, and people use the word resiliency a lot, but I do believe that the Latinx people, just by surviving, is showing the world a lesson. And so my heart goes out to everybody that may be struggling right now, especially with COVID-19 and the intersections of these pandemics also with HIV and COVID-19. And for Marco, your colleague, I wanted to just put myself for as just I will be willing to help to whatever I can in your efforts. That it is very important that we actually get involved in all these aspects that affect everybody when we are working, and there is an opportunity like the groups that you mentioned from Paramount. So thank you for doing that.
Marco, I think we can all learn a lot from your community activism. So thank you. Thanks so much for sharing that. We're going to take a minute and talk about the Elizabeth Taylor AIDS Foundation for a second. You know, there is, Sarah and I could have our own lunch and learn to talk about celebrity foundations. We won't do that now. But what we will say is, when it comes to celebrity foundations, the Elizabeth Taylor AIDS Foundation has set a bar so high that so few have been able to achieve. They are sustainable, they are impactful, they are inquisitive, they take risks. And the fact that all these years later, the Elizabeth Taylor AIDS Foundation is still doing such prominent work in the fight against HIV and AIDS is just something we should all really applaud. We have one of their advisory board members here, Queen Victoria, and we'd love to just hear a little bit more from you about what the foundation is doing to tackle this particular issue.
Awesome. Hello, everyone. My name is Queen Victoria Ortega, as was mentioned. I just want to say that it is a great pleasure to be here today with you, Jennifer, and with all of the incredible panelists that are part of this panel that I know personally. I know Marco and Diana, and they are not only role models for me, so I'm really happy to be part as a Latinx transgender woman as well. I'm completely honored to be part of the Elizabeth Taylor AIDS Foundation. And on behalf of the Elizabeth Taylor AIDS Foundation, I want to thank Paramount for this opportunity to highlight the work we are doing in modernizing laws and criminal penalties for people living with HIV. Everyone knows that when Elizabeth Taylor, our founder, was alive, she was the first celebrity to speak up for the most marginalized during the early years of the HIV pandemic. We continue that work here today, and all of you who are watching get to be part of that as well. As we continue to do that, we also want to make sure that we amplify her bold voice whenever we see social injustice and that we address it. As you mentioned, Jennifer, we are definitely not a group that's afraid to go into the direction that is needed to respond to the needs of our people. For that reason, the Elizabeth Taylor family grandchildren have begun to speak out about the issues of HIV criminalization reform several years ago. It's become an important issue for us as we, as a foundation, have lent our voice to it as well. And this past June, during the LGBTQI Pride Month, we made it actually official, launching our new initiative, HIV is Not a Crime. With our supporter, Gilead, and several leading national organizations and local grassroots coalitions, we are beginning work in Missouri, Nevada, and Ohio to change outdated laws. As was mentioned before, this is just 3 states, but there's 30 states that we need to do work in. So thank you again.
So Queen Victoria, we've mentioned it a couple times. This is a community here at Paramount that loves to just dig in and work hard and help push the needle forward. So what can you tell our audience here today, what they can do to support?
Definitely, I think that it really takes all of us being able to band together. During this pandemic, one of the things that has changed things that we're connecting as human beings however we can. And so I want to challenge all of you that are watching today to take an active part. So thank you for asking that, Jennifer. So you can start by going to etaf.org to learn more about the work that we are doing and to register your email to receive updates on legislation and specific calls to action. So we hope that you can join us. And we're also looking for creative ways to get this issue to the public. Many of you on this Zoom training today and Lunch and Learn are creative. So we're looking to make sure that this content gets out there and that it gets talked about. We need this to be on the national radar so that we can eradicate stigma and push state legislators to modernize the laws. In-kind support for PSAs, for example, or opportunities to work with this issue into the mainstream programming is deeply and greatly appreciated. So that's how we can help.
Thank you. Thank you so much, Queen Victoria. And thank you for making time to join us all the way from London. We really appreciate it. And I know we already have one question in the chat. I think we probably have more than that. I'll let Erin kind of guide us through the Q&A portion of this.
Great. Yeah, there's been a lot of buzz on this side. And for all the panelists, I think you guys may want to just come in and you may want to have a response to some of these questions. There was one early on, just wondering what, if anything, has gone beyond the state level in addressing the criminalization of HIV/AIDS, Tammy?
I'm happy to start. I'm sure others have some thoughts as well. Criminalization is largely a matter of state law, although the federal government oversees various policies, for example, relating to blood donation. And the FDA still requires a 3-month deferral for men who have sex with men. And advocacy continues to, advocacy is ongoing to make sure that that policy is fair and also reflects science. So you may have heard a few months ago, the FDA revised its policy, but it still requires that 3-month deferral.
And, that has actually been something that we have struggled with here at Paramount and Viacom CBS in terms of the blood drives that we've done on the lot. Again, just knowing that they are, somewhat oppressive to the LGBTQ community, but obviously we know the importance of collecting and donating blood. So Tammy, I'm glad that you mentioned that. Does anyone else want to weigh in on this question?
Well, if I may, very quickly, this is Marco. HIV criminalization is a very difficult topic to actually to be dealing with in the mainstream, in the media. First of all, the media demonizes people living with HIV. They treat us as monsters. If you look at most of the media that is written about it, and then on top of that, the perception because of HIV is one of the few actually medical conditions that is criminalized and that is penalized that severely, right? The reason for that is besides racism is also because it's a sexually transmitted infection. And so we live in a puritanic, community and country that is actually selective. And those prejudices really play into why people have this instinctive rejection or supporting of people being criminalized because of their HIV. And also the system itself is created, the justice system is created for people like myself, like Diana, like Queen Victoria, like Tammy, to actually not thrive. That system is so that if we part from that, there is a lot of work that we need to do. And there is a lot of injustice that we need to that we have endured. One of the recommendations is that we actually educate people, being proactive at educating people, not only about legal literacy, but also STIs and HIV literacy, because people change their mind when they learn the details of what people live with HIV. There is one person in Texas who is serving a 35-year sentence because he's caught into a police. And that tells you how ridiculous that is. We know that HIV is not in the saliva. And then there is also the stigma that is actually one of the perpetrators of so much suffering for people living with HIV. So everybody has actually a role in changing this narrative that is actually created purposely to oppress people living with HIV.
So you mentioned Texas and the case happening there. We have another question that asks, which state has given you the most pushback in trying to modernize these laws? Can you speak to state by state where you've had successes and less so?
I think that there's only 6 or 7 states. Tammy went through them actually. But I can tell you that there's only those states that actually have modernized. I don't want to take a lot of space. That have modernized the HIV their laws. I think that each time that a state struggles, it took us in California 3 years to actually arrive to actually for the governor to and we use a lot of the work from the folks from Iowa. For them also it was 3 or 4 years, so it doesn't happen immediately. My friend Kerry Food in Indianapolis tried it last year. So I think that is a process. And Tammy, I don't know if you want to talk about it, but I will say that the states that is going to give us the most and have given us the most back pushback are those states that are actually not very liberated, not I don't want to say Republican, but something like that,
Yeah, so I'll just follow up on that. In terms of the states that have done some work to modernize, those are Texas, Illinois, North Carolina, Washington, Iowa, Colorado, and Michigan. They've all done something to modernize their laws, of course, California. And then in terms of the remaining ones that haven't really made any progress and that still have HIV specific criminal laws or still prosecute people living with HIV under other general criminal laws, they're scattered across the country, but they do, as Marco was suggesting, they are kind of concentrated in the South and some of the more conservative states. And so that continues to be a challenge, but efforts are ongoing. And I think this kind of also ties into a response that I wanted to give to the other question in the Q&A. in terms of what kind of pushback we've gotten. And Marco talked a little bit about this as well. I think a lot of that pushback is due to misunderstandings. So, a significant % of people have misperceptions about people who have HIV and about transmission, how it's transmitted, who is transmitting it, and why that's all happening. And then that lack of awareness causes a lot of people to presume that the current criminal frameworks must exist for valid reasons, which, as we've discussed, is not true. And then when further information is given, in our experience, support for modernization rises quickly, and almost everyone agrees that modernization is important. A nuance in our efforts, however, is that when too many details are given, for example, when too many details about sentence enhancements or costs or other specifics, support then drops again because people get confused, they get overwhelmed. So in your conversations, that may be useful to know. And general messaging around public health and prevention has generally been more effective, though this varies depending on what state you're in and what the social climate is. So for example, I've heard from some of our partners recently that approaching this through a criminal justice lens has worked better for them in this moment than through a public health lens. It just kind of depends on where geographically and socially you are. But in general, the talking points that I shared that emphasize the public health messages and the public health messengers tend to work really well. Interestingly, one complication a while ago now, but back in 2010, studies were showing that the majority of gay men in the US actually supported criminalization because they too were scared and harbored some of the misunderstandings that I mentioned. And that support for criminalization was higher among men who did not have HIV. The groups included people who had lower educational levels, people who were less comfortable with their own sexual orientation, so some of that internalized stigma, and then people tying it back to what we're just talking about, who lived in a state that was hostile to LGBTQ+ people. So a lot of factors come into play, but I guess in sum, the point is that one challenge is just the variety of perspectives in the country and the need to craft messaging that is appropriate for each audience while emphasizing modern science and modern medicine and the need to update these laws because of public health.
I do, Tammy, I remember when Sarah first brought this issue to us and she mentioned that that there are a constituency among gay men who are in favor of these laws. I reacted the same way that Kevin Carter in the chat is reacting with, wow, I mean, it's just so mind-blowing, right? And just so not what you would expect. Aaron, do we have, I want to be respectful of folks' time, and I know that we're over by about 5 or 6 minutes. If there's another question in the chat right now, I want to make sure we get to it. Aaron, do we have another one?
Yeah, there was a question about what kind of pushback against modernization you're coming up against, and I think I would even add what has been helpful in trying to gain support. Has the foundation found useful in getting people to get behind this as a serious cause? So maybe if there's something specific against modernization people are bringing up, or if there has been something particularly useful in gaining support?
I think that the most important thing is that people living with HIV are front and center at the struggle, that actually their lives and experiences are highlighted. We talk about storytelling, and also just talk to everybody that you can. Just have coffee with the persecutors, because they also can criminalize people with HIV because of specific laws that criminalize people living with HIV, and also general laws. So I think that it's important that there is also, for people living with HIV involved in the struggle and their allies, there's this misconception that we don't know anything about the laws. And so what I will also, which is not true, I think that we know about the laws as much as anybody, So I will also suggest for people to be informed. There is amazing, the Equality California has amazing resources. The folks that the Zero Project has incredible resources for you. So it's important to be informed about this issue, and to always try to, again, the people most affected, the communities most affected should be the ones that are front and center in this issue.
I would like to add to what was mentioned by Marco in saying that it is a human story. It is people's lives, and centering the stories of people that are being affected is what's going to change minds and hearts. And for those of you that are involved in creating content that is then digested by the masses, it's getting those stories out and being an amplifier, getting involved. Is what's going to change people's hearts and minds. So we are hoping that you take up the challenge and be part of the team, and that are our champions as well and our partners in making sure that the message gets out, and the stories of these real live human beings also make it out, so that people's hearts and minds can change. Again, I just want to invite you to stay informed and join the cause and visit etaf.org and become a member. Sign up and we'll keep you informed for sure.
That's great. Thank you, Queen Victoria. I want to be respectful of folks' time. Huge thanks to our panelists today. You guys have really done such a great job of informing us of many of us of an issue that we knew nothing about. Tammy, Queen Victoria, Diana, Marco, thank you. To our guests at home, you heard a lot here about staying informed of the issues. I want to remind everybody that on the 22nd next week, we've got a lunch and learn about the ballot referendums, the ballot measures that California is taking a look at in this election day. So please join us for that. It's a nonpartisan conversation about the ballot measures. And next up for Paramount Fights HIV/AIDS, obviously, will be World AIDS Day on December 1st. And we'll keep you apprised of our activities to recognize and raise awareness for that day. But thank you all again, Tammy, Diana, Marco, and Queen Victoria. It's such an honor and a privilege to have this conversation with you today. Thank you.
Thank you. Thanks, everybody.
Thank you.
Thank you.
Thank you.
Go to vote. Go to vote. Remember,
Go
vote.
vote.
Bye.